It might start with an itchy throat, congestion, or feeling tired and sluggish. Whatever it is, there's no question something icky has been going around. Dr. Rubin Patel with Patient Plus says these common viruses are now being linked together under the same umbrella.
The CDC is now grouping multiple viruses together. They're basically calling them respiratory illnesses. They're made up of influenza, COVID, and respiratory syncyovirus. And the reason they're now looping them all together is they mimic each other in ways.
Patel says many people ask him what exactly the differences are between the three viruses.
Influenza is what we typically call the flu, the seasonal flu, which you'll usually see starting in November, maybe early October, and can last all the way to March, April, sometimes May. This current year, we're actually seeing a second wave kind of hitting right now. The other virus is COVID or COVID-19 that we used to talk about. That's actually a coronavirus. The third one is the respiratory syncyovirus or RSV. People hearing more about it now because there's a vaccine offered for that as well, and you see a lot of commercials for that.
While the viruses are similar, Patel explained that they can each have their own unique symptoms.
If we talk about the flu or influenza, we're talking about flu A or flu B. The symptoms run the gamut, headache, fever, chills, malaise, which is not feeling well, fatigue. You can have the runny nose, the cough. Sometimes you'll have some nausea, vomiting. And then the treatment for that is, if you can get it within the first 48 hours, is an antiviral as well. The ones that people are hearing about are Tamiflu, which you would take for 5 days, or Xofluza, which you could take for 1 day.
And with different symptoms come different recovery periods.
COVID can last from several days to a week. The flu can last anywhere up to a week as well. Some people 2 weeks, and then RSV is about the same time, one week. So it's all just, some people maybe 48 hours, but others maybe longer.
But how can you protect you and your family from getting the ick? Patel says many of the precautions are the same now as they were at the beginning of the pandemic.
We've talked about this since COVID. Hand washing. If someone in your house is sick, just make sure you're kind of separated from them. I'm not saying you need to wear a mask, but maybe they wear a mask while you don't wear a mask. And then just taking care of yourself, right? Get plenty of rest, drink lots of fluid, eat the right foods. Those are the things you can do.
Reporting from St. George with Unfiltered with Kieran, I'm Mason Miller.